Greetings, my name is Crystal James, and I'm a public health trained attorney serving as Special Assistant to the President for COVID-19 recovery. This video will highlight some of the key public health strategies that are outlined in the University Roadmap to Reentry and COVID-19 policies and procedures.
What has the university done to prepare campus for the return of faculty, staff, and students?
Paraphrasing a quote from the movie Red Tails that depicts the adversity the Tuskegee Airmen face throughout their training and many missions. Nothing is difficult, everything is hard. COVID-19 presents challenges none of us have faced before, and much about the virus and its impact remain unknown. Therefore, we all assume a level of risk each time we leave our personal space. The university, since the beginning of our response in March 2020, which led to the decision to go virtual learning only as our method of instruction, has been preparing our campus for the return of faculty, staff, and students. The health and well-being of the Tuskegee University community is a shared responsibility. We all have a role to play in keeping ourselves and each other safe. Everyone is required to strictly adhere to the health and safety measures outlined in the Tuskegee University COVID-19 Policies and Procedure Manual, which may be found on the website at www.tuskegee.edu/coronavirus-resources. A few important guidelines listed and things to note in these policies are: all students, faculty, and staff must demonstrate a negative COVID-19 test before they can return to campus. Sentinel COVID-19 testing will assist in the identification of asymptomatic carriers of the virus. New restrictions regarding gaining access to the campus will be enforced. Wearing a mask or face covering is mandatory when outside of your personal space. Hand washing and safety protocols are emphasized, as well as strategies for physical distancing in common areas and classrooms are explained. We also have detailed information about the facility's cleaning procedures according to federal guidelines. Anyone who repeatedly chooses not to comply with our policies and procedures will face disciplinary actions up to and including suspension, expulsion, termination, or being barred from campus. Preparing our campus also begins with being good community partners by assisting in the preparedness of the community at large. To that end, the Community Health Task Force, through our dedicated faculty and staff, working through the Community Engagement Subcommittee and Antiretroviral Subgroup, have been advocating for the Macon County community to have access to more widespread testing, which led to the Alabama Department of Public Health's Chief Medical Officer authorizing the university to prepare COVID-19 tests for local medical facilities on April 17, 2020. Since that time, our scientists and laboratorians have donated their time and laboratory supplies to supply this resource, and that effort continues today. Our advocacy and leveraging community partnerships not only assisted the Movement 46, a local community-based organization, in sponsoring testing clinics in the community, we were there to assist in the implementation of the clinics as well. We have endeavored to support other Black Belt and surrounding counties, not just Macon County, by providing limited amounts of personal protective equipment, or PPE, to first responders when sourcing these items was extremely difficult in our community. Some of the agencies that we were able to assist included our own TU Police Department, Macon County Health Department, Choice, a nonprofit organization headquartered in Uniontown, Alabama, Baum International Healthcare Centers Incorporated in Linden, Alabama, Community Hospital in Tallahassee, as well as Butler County Police Department.
What is the COVID-19 Recovery Management Center?
The new COVID-19 Recovery Management Center, or CRMC, is dealing with the many questions that must be addressed as Tuskegee University moves forward with mitigation planning to return to campus. Public health differs from healthcare in one key aspect. It is concerned about health at the population level beyond the direct service to individual. Restated, public health is group work for communities. The CRMC will coordinate the efforts to mitigate the spread of disease by leveraging the expertise of faculty and community stakeholders in small working groups to enhance preparedness at the university, city, and county levels. The CRMC is charged with recommending university-wide public health strategies and guidelines that are needed for helping us live and work on campus in order to pursue Tuskegee University's education and research mission while managing the cultural shift of living with COVID-19. Part of that responsibility is assessing changes to mitigation strategies released by the Centers for Disease Control and Prevention, the Alabama Department of Public Health, and Macon County Emergency Management Authority, while modifying the university policies and procedures to adhere to the most recent science-based evidence. The CRMC's role assures that TU is drawing on its world-renowned research faculty, veterinary medical expertise, and other health sciences programs to guide decisions on the health and safety of students, faculty, and staff alike. The CRMC will also work in collaboration with community partners, such as Macon County Emergency Management, the Macon County Council of Governments, faith-based organizations, and corporate partners to ensure that ideas, strategies, and guidance from all stakeholders are critically considered in policy decision-making.
How will students get tested before returning to campus?
All students are required to be tested for COVID-19 before they return to campus in the fall. Testing is provided free of charge by the state of Alabama through its Testing for Alabama program. Each student will receive a notification providing the location of a laboratory in their current zip code, which will conduct the test prior to their arrival on campus. They will receive their results reported via email and through the testing registration portal. If you have tested positive for COVID-19 in the past 12 weeks, you will not need to be retested. However, you must provide Student Health Services documentation of your positive test and a healthcare provider's medical clearance before you can return to campus in the fall. If you have not received a positive diagnosis within the past 12 weeks, you are required to participate in the university's re-entry testing program. If you are not showing symptoms but test positive, you will be required to self-isolate for 14 days to help protect others in the community.
How will the university conduct monitoring of the COVID-19 spread on campus?
Sentinel testing strategies will be deployed, which means we will utilize an algorithm to randomly select students, staff, and faculty to be tested periodically to monitor for asymptomatic carriers of the disease beyond re-entry testing that is required. Cluster testing will also be conducted when necessary. As an authorized site to develop our own transport media/test kits, as well as our efforts in partnership with Thermo Fisher to become a CLIA certified laboratory, which means we meet the requirements of the Certified Laboratory Improvement Amendments to process samples here on campus, we are uniquely situated to detect new cases and implement our proactive plan for when a student or staff member tests positive for COVID-19.
What is the Golden Tiger Health Check?
The Golden Tiger Health Check will help us all return to campus safely and help our community monitor COVID-19 related symptoms. Before returning to campus, all students, faculty, and staff must complete the Golden Tiger Health Check, a web-based health tool that assesses existing and any current COVID-19 related symptoms, exposure history, and testing history. The Golden Tiger Health Check may be accessed from any computer, tablet, or mobile device. All faculty, staff, students, as well as dedicated contractors for the university will be required to complete the Golden Tiger Health Check daily.
Why is it necessary for students, faculty, and staff to utilize the Golden Tiger Health Check?
Employees and students are required to log on daily to report symptoms, even if they're not feeling ill. This will ensure a safe return to campus. The initial survey takes about 20 seconds to complete. Subsequent surveys will take about 10 seconds to complete. Employees and students completing the Golden Tiger Health Check daily will allow the campus to have a better idea of asymptomatic and symptomatic occurrences as we do our sentinel testing. If your survey responses indicate that you are symptom-free and you've had no close exposure to a COVID-19 illness, the individual is cleared to re-enter campus. Thank you very much for your attention. I hope that the detail we provided in this video will help you as you move through the policies and procedures that are listed on the website. Again, please go out there and take a look at them. There's some very good information about how we all can stay safe together.